on an all-new Dr. Phil.
We're going to be dishing out some 5-minute fixes.
Fast remedies.
My husband is a hypochondriac.
I'm driving myself crazy.
You're not crazy.
For a better life.
She has had 6 nose jobs.
I've never been happy with the nose.
I have a quick fix.
5-minute fixes.
I am afraid to go to a gynecologist.
You trust Dr. Masterson.
I feel like I know her.
Yeah. Would you like to know her better? This is going to be a changing day in your life.
Have a good show, everybody. Here we go.
It matters to you. That's what I want to talk about. Are we ready in the booth? Let's do it. Go, Dr. Phil. Often said that we don't do 8-minute cures on this show, but today, well, that's kind of an exception, because we're going to be dishing out some 5-minute fixes to some things that really crop up in your life a lot. Throughout the show, we're going to be giving you some of the most efficient, effective ways to better your health and expand your lifespan. But I'm not going to do this alone, because joining me today are America's medical dream team. You know them as the host of the Emmy Award-winning daytime hit, The Doctors.
Doctor, give me the news.
Make a fist, and you're going to grab inward thrust.
This right here, that's your frontal lobe.
That is such a cool
thing. Lift the bump. There we go.
Trying to keep the computer from scoring here, Travis. Pretty cool.
Very quickly, 100 per minute.
Hey. Don't you do to me what you did a minute ago.
I don't want to die.
I wanted to say thank you to all of you.
Please welcome Dr. Travis Stork, Dr. Lisa Masterson, and Dr. Andrew Orton. Good to see you. So much. Good to see you. Yeah, all right. Thank you. All right, now. Thank you. Now, Dr. Jim Sears, also a cast member here, couldn't be here today in person because, well, it's flu season, and that's like tax season for accountants. So he couldn't get out of the office because he's got little kids lined up around the block with flu, and we said, stay there, we're going to have him here by video. But he sent along some of his quick fixes for everything from flu-proofing your family to lowering your blood pressure, and we're going to give them to you throughout the show. But first, Dawn wrote to me because she says her husband, Randy, is a hypochondriac, and she says she just can't take it anymore. Take a look.
My husband is a hypochondriac.
I think about my health all the time. Every night when I come home, I'm usually on a computer for 1 to 2 hours, just searching for different remedies.
Randy has researched anything from having a heart attack, gout, kidney failure.
Anytime I feel a pain in my body, right away I think the worst. If I start to get a pain in my calf, that could be a blood clot starting.
If Randy has a sore throat, he thinks that he's got cancer of the throat. If Randy gets a pain in his arm, it's definitely a heart attack. If Randy has a bad headache, it's always a brain tumor. Randy constantly checks his pulse. Sometimes he even checks mine to see if mine was as normal as his was. We have a daughter who is 7, and he was also testing her.
I'm very afraid of dying. A lot of nights I don't even want to go to bed because I'm worried I might not wake up.
We've gone to the emergency room probably once every 4 months because Randy thinks that he's having a heart attack. Randy has never had a heart attack. If Randy doesn't seek help, I really have a feeling that he's just going to drive himself crazy.
Is there something that I can do where I wouldn't be so consumed about my health and about dying all the time?
Okay, now this is interesting because you realize that what you're experiencing is not rational.
Correct. I'm driving myself crazy over it, really.
Okay, and Dr. Stork, that's not usually what you hear from someone that describes himself as a hypochondriac. They come in and they think, no, I am dying. This isn't craziness, I'm dying.
Right. So you at least have some insight. But the one thing that you know is if you obsess about your health, that's not healthy.
What do you understand hypochondriac to mean? I got a feeling you know the answer to this, but what do you just think it means?
Well, constantly worrying about your health. You know, every time you get a little pain, it's more than just a pain. If I get a pain in my back, right away I think the worst, that it could be kidney failure, my liver's going out, or I have a tumor growing, or, you know, something like that.
What's your payoff for this? What do you get out of it?
A lot of stress.
No. You get something out of it. Look, people don't do things over and over and over again if they don't get some reward for it. Are you a drama king?
No, I don't think so.
Well, but yeah, how can you say no, but a muscle twitch is a heart attack? I mean, isn't that drama?
It is.
He's a drama king in the sense that he's going to do research on it and find out what it could be.
Randy does have some actual health problems, but he refuses to follow his doctor's orders when he does have something wrong. Take a look.
Instead of following the doctor's advice, Randy reads what other people write on the internet and follows their advice. Randy has battled gout for approximately 15 years. Randy opted not to take the prescribed medication and just do his own remedies.
I take black cherry extract twice a day. I also do take turmeric.
Randy found that lemon juice and water is supposed to help with his gout. At the end of the day, the gout is still there even after he's tried all these internet remedies. All the remedies that Randy has bought just sit in this cabinet, and even if they're expired, we can't throw them out because at some point Randy may need that remedy again. I think Randy needs to get to the doctor. He needs to take some blood tests and find out really what's going on with his body.
Okay, now actually there are some things that you can do on your own to manage your health, of course. In fact, Dr. Travis Stork and the doctors have put together a new book called 5-Minute Health Fixes, and it's full of easy tips to improve your life. I was asking you about your payoff. What do you think I mean by that?
I don't know. I really don't know. I don't think there is a payoff worrying.
What do you think the payoff is?
I don't see a payoff in any of this.
Well, just assume for me that we don't do things repeatedly that don't pay us off.
Well, I'm guessing that, yeah, he's relieved when he finds out that, you know, the symptom is gone and he's okay in his own mind.
Am I missing something here? Do y'all get what I'm saying? You do stuff because it works, right? You get something out of it. You do it because you get something out of it, right?
No, I really don't.
I see a lot of people in the emergency room who have symptoms and they accentuate them, especially nowadays, because you can go online, punch in a symptom, headache. Next thing you're reading about a brain tumor, and then you'll come to the emergency department and you're telling me you have all the symptoms of a brain tumor, not because you have them, because you read about it and convinced yourself you have them. So it's a dangerous time.
We've even developed a new term for that. It's called cyberchondria. Okay? It's called cyberchondria because people go into cyberspace, they look all of this stuff up and are highly suggestible. So they read all of this and go, oh, yeah, I have that. Oh, yeah, I have that. I do. And so they self-diagnose at that point and then become very stressful.
Sure.
And that you do that some, don't you?
Oh, I do it a lot. I do it a lot, yes. Yeah. I mean, almost probably every night. I mean, you know, if I'll get a pain in my side, then I'll go online and research it. And, you know, then they tell you about a appendix and your appendix going bad and it's a short one where you can die and it can explode. And so it's like, you know, how long do you wait? Should I go to the doctor? And shouldn't I go? And so, you know, when the pain goes away, it's like, ooh.
So when you look all of these up and it turns out you don't have them, you're relieved?
Well, I don't know that I don't have them till the pain or symptoms go away. Then I'm relieved.
I think I'm getting a brain tumor. Dr. Travis says that you should only use valid websites to research conditions that you have actually been diagnosed with. You know, wait till you're diagnosed, then do your homework, then do your research. Now, if you go to drphil.com right now, we're going to have a list of them for you there. Now, next, I want to tell Randy what he needs to do to stop stressing about his health and to really control this, because it really is disruptive to your life. And later, a woman who's thinking about having her 7th nose job. We'll be right back.
Randy has this vitamin case that he carries with him every single day.
I have turmeric in there. I have pantothenic acid, aspirin I keep in there at all times for heart attack. If I don't have my vitamin pack with me, I start thinking what happens if I start to have a heart attack or chest pains or whatnot. Then what am I going to do?
We were going to go on a cruise, and they were predicting bad storms, and Randy was worried that if he got on that cruise ship and the water was a little bit rocky or wavy, that he was going to have a heart attack and he wouldn't survive. So we had to cancel our trip.
This isn't malingering. He's not faking this to get out of doing something or going on a cruise or whatever. This is very real to you at the time. And your concern is very genuine, right?
It is.
And it's very stressful to you.
Oh, absolutely.
At the time. And often underlying this is anxiety. And it's not anxiety about any one thing. It's just stress and pressure, and it has to find an outlet. Mm-hmm. And in this case, the outlet has seemed to be an overemphasis, an overfocus on symptoms that are misinterpreted as being something more serious than they are. What you have to be willing to do is to accept that this is from something else, and that something else is anxiety. If we can teach you how to manage anxiety without having to get into this cycle of build, relief, build, relief, build, relief, if we can teach you to do that in a more constructive way, then your need, subconscious or otherwise, for overemphasizing this symptomatology would go away. One of the ways that you do this is through what's called biofeedback training.
Okay.
And you are so attuned to your body, where you listen to your body so well and you focus on it, that those skills can actually be used very productively to help you gain control in this other area. You're not crazy. This isn't some kind of bizarre mental illness here. Okay. You need some alternative coping skills to handle this. And if I arranged that for you, would you do it?
Absolutely.
To get you some biofeedback training and get you some ability to manage this anxiety, you would do that.
100%. Sure.
Dr. Travis Stork also has some advice on when you should go to the emergency room, because I don't want people to get the message that you just ignore all of these things. You overreact to it, right?
I do.
If you're in doubt, you do want to get it checked out. No question about it. Let's say you're suffering from a headache. You know, if this is acute onset of the worst headache of your life, and you have confusion and fever and a stiff neck, or let's say you've lost consciousness and you have a continued headache, you want to go get that checked out. Don't minimize that. Or let's just say you're at home and you have nausea and vomiting and severe diarrhea. You can't keep down fluids. You can get dehydrated very quickly. So don't be a minimizer and say, oh, I'll be all right, even though I can't get out of bed. So there are times where you have to listen to your body. But you prove to be challenging for doctors like us, because we don't know when it's real or not real. That's why you need to get this fixed.
Absolutely.
And these are things that you guys cover in the book, 5-Minute Fixes. There are some of the things in there that you just need to know, so you know when to pull the trigger and actually go to a doctor versus when not to. We're going to approach this from a different area. We're going to look at what's underlying this, take that need away, and I think you're going to see this dissipate in fairly short order.
Great.
Okay?
Very good.
You'll be relieved, right?
Absolutely. Yes.
All right, good deal. All right, next, she's 20 years old and is terrified to go to the gynecologist. Plus, how to enjoy your holiday cocktails and not get that hangover. Yeah. But as we go to break, here's Dr. Sears with a tasty 5-minute fix to lower your blood pressure.
Hey, Dr. Phil. Hey, doctors. Here's some great news for all those chocolate lovers out there. You can actually lower your blood pressure by eating dark chocolate. An Italian study found that if you eat one small piece of dark chocolate every day for 15 days, you can lower your blood pressure by 6 points. And it significantly enhances your body's insulin response, which is a key at preventing diabetes. But remember, we're not talking about the whole bar, just one small piece.
I'm Stephanie, Elise, Alicia, and Allison.
Our question is, how do you cure our hangovers?
After a night of drinking, I'm usually on the bathroom floor the entire next morning being sick.
I usually go to the bathroom numerous times throughout the night to throw up.
My hangover means I spend the entire next day in bed. I get terrible headaches and experience light sensitivity. Please help us.
Dr. Travis, is there a way to prevent a hangover? I mean, can you do it?
Obviously, moderation, drinking water in between drinks, but there's no magical cure for the hangover.
So water, is that to reduce the volume that you drink, or does it just water it down?
Well, a little bit of both. You're staying hydrated because alcohol can dehydrate you, so the last thing you want to do is wake up the next morning severely dehydrated with your hangover.
My next guest, Christina, wants help getting over her fear of going to the gynecologist. Take a look.
Hi, Dr. Phil and Dr. Lisa. I need your help. I am afraid to go to a gynecologist. Ever since I got my period when I was 10 years old, I've dealt with terrible menstrual cycles. I would get pain so bad, hot and cold sweats, the shakes, I'd vomit, I fainted, and had to seek emergency medical help. Every time I think about going to a gynecologist, I freeze, I fight it, I don't want to talk about it. It terrifies me to let a stranger see me that way and touch my private areas that I know it needs to be addressed. 10 years is long enough.
Okay, now my goal is to talk you out of this fear. But, Lisa, the truth is, this has got to, I mean, she has a point, right?
Oh, absolutely, and that's a lot of reason why a lot of women take a lot of time not to go to the gynecologist. It's difficult for a woman to reverse her mindset. There's a stranger, she's going from the pediatrician to the gynecologist, and that's a huge leap for a woman.
What do you think is going to happen that's bad?
I just feel like, from what I've heard of going to the gynecologist, it's basically you get into a room, you take off your clothes, and you let a stranger touch you. Like, what? Like,
no. You just described going to a bar. That's not what happened.
That's what women think. It's all about you taking control of your health and your body, and that's what we have to switch it to, is that you're actually in control of your body, and this is a good thing.
Let's take just a second and talk about the downside of not going to a gynecologist for as far into life as she is.
Now there's an HPV vaccine. We can keep you actually from ever getting cervical cancer because of STDs. So the consequences with STDs are not only that you may have an embarrassing sexually transmitted infection to talk to someone about, but we know it can cause infertility, it can cause severe pelvic pain, it can cause death in certain instances, depending on what you have.
And you have a lot of pain, actually, right?
Yes. Yes.
Okay, now your sister Laura has actually tried to trick you into going to the gynecologist. How did you do this?
I've tried to make a lunch date with Christina, go out to lunch, and then happen to pull into the parking lot, and then the door's locked, and she's like, I'm not getting out. I've made appointments for her. I've even offered for her to come in and watch me get an exam so she can see exactly what goes on.
Well, that's a generous
I mean,
and fair offer.
And I know she's concerned. You need to go first just to meet the doctor, and that's okay. And then go for the exam second, because the indication for an actual exam is if you're having problems, like if you were having cramps, or if you're 21 or sexually active, whichever comes first. So that needs to happen.
And I've asked Robin about this when we were having our first baby and everything. Do you feel funny about this and all that? And she said it very well all those many years ago. She said, if you go to a professional, they are professional. Your modesty is respected. You know, you're draped, you're covered, you're not vulnerable in some way. People aren't coming in and out of the room. There's complete and total privacy, respect, and professionalism. So this isn't something where you have to feel that you're going to be disrespected or exploited or anyone even being insensitive to your concerns.
We tell you exactly where we're going to touch you at any time if you want to be touched. Again, it's all about you being in control.
Now, you said you actually trust Dr. Masterson because you watch her, right?
Yeah, I've watched the doctor show for several years.
So you feel like you know her?
Yeah, I feel like I know her.
Yeah. Well, would you like to know her better? Let me tell you why I'm asking that. Because you watch the doctors, you know that the doctors has an exam room, a very professional examination room, no cameras. No cameras, just cameras to kind of introduce people. Here it is. See it right here. Wouldn't this be a great time with a doctor that you feel like you know and trust to go and have that first preliminary exam and get it over with?
Yes, it
would. You do that?
Yes, I think
so. Are you going to do that?
Yeah, I'll try.
All right. Up next, she had 6 nose jobs and now wants a 7th. Plus how to flu-proof your kids, and then we'll hear about how this goes by the end of the show. We'll be right back.
I've had 6 nose surgeries, and I am still not happy with the results. I was always hoping it would be the last surgery, but there's always something that I was disappointed in.
Here are a few really important tips to keep you and your family healthy during flu season. First, you gotta eat well. Lots of fruits and vegetables and lots of fish. Those things really boost your immune system. Next, you gotta exercise. Staying active will boost your immune system also. Prevent the spread of germs. Have a little hand sanitizer in your purse. When you pick the kids up from school, have them use it. And if they're gonna be coughing, you teach them how to cough the right way. Don't cough into your hands, kids, because that's gonna spread the germs also. Cough into your elbow. I call this a birdie cough. That's how birds cough. Or, for the older kids, a vampire cough. Whoa.
That was Dr. Sears from the Doctors. That was a great tip, and you can find more great advice in their new book, 5-Minute Health Fixes. Now, my next guest, Cynthia, says that she has had 6, count them, 6 nose jobs, and is now contemplating a 7th.
I've had 6 nose surgeries, and I am still not happy with the results. Growing up, I was not a pretty child, and I was never happy with my nose. I had been wanting to trim it down and make it look more feminine. I had my first procedure done in 1981. I didn't feel that the difference was appreciable. The second procedure was done in 1984. I was not happy with the result. I had a 3rd surgery. In 1996, I found a teaching hospital in my area. I had 3 procedures done at this hospital. After all the surgeries I've had, no one has ever said, "Gee, you're looking good these days." No one's ever noticed. I wish the doctors had listened to me more. I have never felt that they have done what I asked for. After 6 surgeries, I wonder if my nose could handle a 7th one. I would like to know if I should have a 7th surgery or to leave well enough alone.
Okay, what's your gut instinct tell you?
But it should have been corrected the first or second time.
How does this happen, Dr. Orton?
Well, you know, that's the thing. I think for plastic surgeons, nasal surgery, without question, is the hardest procedure that we do. And you can do a perfect operation and not get a perfect result. Your first procedure you had done, you were still a younger woman, and you just wanted a little definition in your tip, correct?
Yes.
What happens every time you operate on a nose, altering the anatomy, in spite of an ideal surgery, things can settle in a funny way. The patient's not satisfied.
Oftentimes, patients will have a problem with self-esteem, they'll have a problem with self-confidence, and they'll kind of target that into one body characteristic, and they'll kind of become obsessed with that. Do you think that your focus on this over all of these years is to the point of being counterproductive, point of being obsessive?
It's absolutely excessive. I don't know about obsessive. I may have been preoccupied with my nose, but in general, I'm a very happy person. I'm accomplished, but I've never been happy with the nose. Without makeup, I still have a very homely face. I was taken for a boy several times, all through my childhood and 20s. Yeah.
Is that part of your motivation, that if you had a finer line nose, that you might look more feminine?
I just wanted a more feminine nose.
You know, we see this with nasal surgery, that you go so far, but you're not quite there, and you want a little more. So we do see this, but you know, each time you do an operation on the nose, it's more difficult to change it.
Well, something
going further
that jumped out to me, and tell me what you think about this. You said the first one was done at age 30, but then you said numbers 4, 5, and 6 were done by a resident?
It was done at a teaching hospital.
You know, and I know where it was done. Excellent facility and excellent institution.
Yes.
And the point being here, when you get to the point of 4th and 5th noses, those are probably not best done by a resident. A resident is just not in a position to handle that because that's a very difficult case.
One of the things that I did in practice is plastic surgeons, if they had a question, they would sometimes send them to me for evaluation to determine whether or not there would be a possibility of a good outcome. So I've been in this situation a lot, and had you come to me and I'd evaluated you to make a recommendation to the surgeon, I would say not just no, but hell no. You don't want to do this. I mean, if this went badly for you in some way, you would have taken a situation that is wonderful, and taken the risk of going really wrong.
Dr. Phil, you're talking like a nasal surgeon. In all fairness to her, a couple of these procedures that she had done were related to breathing problems. That the nasal surgery that she had initially ended up giving her breathing problems she didn't have. And that's a little bit of a vicious cycle that we see with noses. That's why it's so important to identify those going in.
Well, we have a photo here of Cynthia's profile, and so, Dr. Orton, I mean, tell us what you think.
Well, you know, and I think we're all in agreement. Who would say that she looks pretty good here? And seeing you know, I think that your tip projection is pretty good. You have a nose that fits the rest of your face. I have a solution for you, a quick fix, and all it involves is an injection, not in your nose, but in your upper lip, your premaxilla. And what it entails is just bringing out your lip. Do you see that? Uh-huh. And what that does by doing that, by bringing that out slightly, it makes your nose look a little bit shorter. It gives it the appearance of being deprojected and makes it look better. Without touching the nose, a quick fix which will give you a little better look and I think help you your biggest deal. You still feel your nose looks too big.
That makes sense to you? Would you consider that?
I would absolutely consider that.
Then can you do that?
I can do that.
All right, we'll do that for you.
We'll do that for you.
All right? Yes. Big stuff. All right, coming up, we're talking about how to eat less sugar and have better sex, but not at the same time. We'll be right back.
Here's one of my favorite healthy food substitution tips that your family might not even notice. Instead of using sour cream, try switching to low-fat Greek yogurt. It's so much healthier for you. Serving for serving, low-fat Greek yogurt has less than a quarter of the fat, a third of the calories, and 3 times more protein than sour cream. So whereas sour cream is actually bad for you, Greek yogurt is good for you. Why not make the switch? As a matter of fact, a few weeks ago, I was kind of tricky with my family. I emptied out the sour cream container, poured in the Greek yogurt, served it with our tacos, and nobody knew the difference.
Hi, Dr. Phil. Hi, doctors. I eat way too much candy. Ever since I was little, when I would go to restaurants, I would eat the sugar packets right off the table. As I got older, I would spend about $30 on Skittles, Sweet Tarts, Smarties, and Fun Dip, about 2 to 3 times a week. I began to try to cut out candy. It only lasted 48 hours. I couldn't get out of bed. I had an awful headache, and I feel like I crave sugar. Is it all in my head? How can I end this sugar addiction?
All right, well, that was Emily, who wants to know how to break her sugar addiction. And here to help me answer that question are 2 of the hosts of the daytime Emmy Award-winning hit, The Doctors. Now, they've put together a new book called 5-Minute Health Fixes. Emily's going to join us via Polycom. Emily, are you there?
Hi.
Hi.
Hi
now,
there.
You know you're eating a lot of sugar, right?
Yes, it's a major problem that I know I need to stop.
Okay, and you've been doing this for how long?
Ever since I was really little. It got bad once I got my license, though, and I could just go get it on my own.
Yeah. You're eating 12,855 teaspoons of sugar a year. A year. And that's over 600% of what is recommended for her to be taking. Travis, what do you think?
The problem is nowadays you can pick up a package of anything on a grocery store shelf or soda that's loaded with sugar, and it's a reinforcing cycle because it actually increases the release of neurochemicals that give us pleasure.
Right. I said you were eating a lot of sugar. Do you have any idea what that looks like, 12,855 teaspoons?
I have no idea.
Well, let me show you. Let me show you. Because we are talking about a lot of sugar. Are you surprised?
Wow. Is this why we have Emily on Polycom? Because she starts salivating?
Think about this. Whoa! You're putting that into your body day after day after day after day after day.
You know, Emily, I'm going to appeal to your vanity. We know that eating too much sugar in the diet has a bad effect on your skin and aging. I mean, that's for sure. So that's another reason why you've just got to nip it in the bud.
Every year that we go through life, our metabolism slows down. So when you're a 19-year-old, your body is primed to use sugar as the main source of energy. But the longer we go through life, the more hours of TV watching we do on the couch. What happens is that sugar settles around your belly, and it creates something called visceral fat, which leads to heart disease, diabetes. I think the biggest issue here is Emily, just like all of us, we're getting a lot of sugars and things that we don't even realize.
Yeah.
Your pasta sauces are sometimes loaded with sugar. When you go buy processed crackers, loaded with sugar.
Okay, now, Emily, here's the thing. You need to understand this is a form of addiction. After you get this out of your system and then you start to eat it again, it's going to seem really sickening to you. Emily, do you think you could go cold turkey on this?
Well, I've tried, and it was a complete failure.
But here's what you got to be willing to do. You got to get the people around you. You got to get your friends. You got to get your family. And you got to tell them, you need to treat me like an addict for about 3 or 4 days here and pat me down when I come in. If I got a Kit Kat bar on me, take me down and get it away from me. And you've got to resolve, you know, for 72 hours here, I'm going to do it. And I promise you, if you'll get through those first 3 days, you will be a whole lot better off. Fair enough?
Fair. I can do it.
We'll see. I want to hear from you after 72 hours, okay?
Okay.
All right. Where's Maria? All right, Maria, you have a question. What is it?
I wonder why guys have it more difficult for an orgasm when they're drinking, but at the same time it feels like they're more interested of having sex.
Okay.
Who gets to answer this one? I'll arm wrestle you for who gets
you win. But how about this? You answer the first part. Why, after a few drinks, is a guy more interested in sex?
Well, obviously, because it's just relaxed him. It's decreased his anxiety level. He's free and easy and relaxed.
And after a drink or two, both men and women, they do relax. And so it can be a bit of an aphrodisiac. But the problem is alcohol is a central nervous system depressant. And you need your central nervous system as a guy to make things happen down there. And the more you drink, the less you're able to do that, because the depressant action of the alcohol is saying, all right, this isn't going to happen. And so the guy may want it to happen, but it just can't.
It also distorts their self-perception. Because they may look like Pee Wee Herman, but after a few drinks, they think they're James Bond. So, and they walk in and say, yeah, every woman in here is looking at me. All right, when we come back, a mom who needs a fix for stinky feet. Plus, we're going to find out how Christina did in the lab next door at the doctor's. We're going to hear from Dr. Lisa, find out what happened. We'll be right back.
I'm Erica, and this is my daughter Layla, and our problem is we have stinky feet. Layla's only 8 months old, and her feet already stink, and I've been dealing with the issue since high school. I've tried powders, sprays, I've tried different shoes, different socks, and nothing seems to work. They pretty much smell like garbage. And my husband even makes me wash my feet before I go to bed. Can you help me?
Well, that was Erica with actually a very common but yet embarrassing situation, but luckily there is a solution, and Mel back here is actually soaking in us. So, Dr. Stork, tell us what she's doing. Obviously, she's in some, it's just regular tea?
Black tea?
It's black tea.
Black tea.
So if you brew up black tea, a big batch of it, pour it into a foot bath, let it cool, obviously, and soak your feet for about 30 minutes. Not only is it soothing and relaxing, but the tannic acids in the black tea will actually help dry out those sweat pores and kill off the bacteria. Because the bacteria that grow and feed off that sweat, they release the odor. It's not your feet, it's the bacteria's fault.
You've been soaking in this for how long?
About just maybe 2-3 minutes. It smells great, great aroma.
How often do you have to do this?
You should do it every day for a week. And then after that, as needed.
All right, now, before Dr. Lisa answers another question, I need to find out how things went with Christina in the doctor's lab. So, how did things go?
She did great. She just flew through it, and I know she feels so much happy about it, and she just, everything's healthy, and she just did fabulous.
So, first off, you didn't find any problems at all?
Didn't find any problems. Everything's nice and healthy, perfect. She just breezed through that.
How do you feel about having gotten it done?
Much better.
You feel relief that you're through that?
Exactly, especially since she said everything looks good.
Well,
so that's like, whew, thank gosh. But it wasn't as bad as I thought it would be.
All right, we have another question for Dr. Masterson about menopause. Judy, where are you? What's your question?
I'm wondering if it's okay to go off of estrogen, just cold turkey, or do I need to wean myself off of it?
That's one thing you don't want to go off cold turkey, because if you go off cold turkey, it's going to kick you back, you know, it's going to give you a little kickback, and you're going to get hot flashes or other symptoms that you had back with a vengeance. So that's something you want to wean yourself off of. So talk to your doctor about how to wean yourself off of it, what's the best for you. So yeah, don't just stop cold turkey. We want you to be on the least amount as possible for the shortest amount of time. That's the recommendation now. So you do want to wean off eventually.
Okay, thank you.
Cool. All right, we've got one more question from Deborah about burns. Deborah, what's your question?
What is the proper way for us to treat burns? Because I'm tired of soaking myself in fat.
People of color are more likely to form scars, so treat a burn the right way from the get-go. And we get into this a little bit in the book. I don't know if you've heard this wives' tale. Number one, don't butter a burn. That if you have an acute burn, you don't want to put butter on it. That actually can help promote the burn to be worse and lead to infection. The best thing to do is to immerse a burn in cool water. After that, if you have a second-degree burn with a blister, don't pop it. Let it just rest there naturally. You want to apply something moist in the form of aloe or a triple antibiotic ointment. That's a good thing for a burn. And put a bandage on it that doesn't stick, so that when you peel it off, you're not peeling the skin with it.
Yeah. All right. Good advice. All right. I appreciate it. And also, on the website, we're going to have do's and don'ts if you're thinking about getting some plastic surgery done. Dr. Orden has those for us. We'll have those on drphil.com. immediately after the show. We'll be right back. Well, I want to talk about an exciting event that's coming up. For the first time ever, Susie Orman, Dr. Oz, and I are going to appear on one stage together in Ask Oprah's All-Stars. This is a 4-part, 2-hour special on OWN, the Oprah Winfrey Network. Now, Oprah's network launches on 1/1/11. And let me tell you, this is going to be exciting. I'm really involved in this network with Oprah, I'm proud to say. I'm doing a number of different projects with her, including Ask the All-Stars. I'm doing a series called Finding Sarah that deals with the Duchess of York, Sarah Ferguson. We've been doing something called Get Your Own Show to find the next talent that will have their own show on the Oprah Network. And you're going to be able to see the Dr. Phil show every night on the Oprah Network as well. So we're very excited about all of this that's coming up. So Ask Oprah All-Stars premieres on Sunday, January 2nd at 8 o'clock, 7 Central. Now, we're going to be answering your questions about relationships, health, your body, and finances. Now, our goal is to help people live their best life ever in 2011. And you can ask us anything. So go online now and send us your questions. You can go to the Oprah All-Stars page on Facebook, or you can go to drphil.com for a link to Oprah's All-Stars. Now, as for today, I want to thank all of my guests for being here, especially Dr. Travis Stork, Dr. Lisa Masterson, Dr. Andrew Orden, and a special thanks to Dr. Sears for his great tips as well. The doctor's new book, 5-Minute Health Fixes You Want on Your Kitchen Cabinet, so you can pick it up if something happens in your house. It's in bookstores now, and let me tell you, it just makes a great holiday gift. And everybody in the audience today is going home with a copy of this book. Thanks for being here. So long. Thanks, Doc. Thanks, everybody.
Today on an all-new Dr. Phil.
A mother will step in front of a bus for a child, not throw him under it.
Whose son OD'd, and his friends blame mom.
I do feel that Heather killed Brandon.
I did not kill him.
The drugs.
You said you showed Heather the crushed pills that Brandon took from her purse.
Yes.
He did not show me that.
The alcohol.
I showed her everything on the counter. Beer cans, the vodka bottle.
I didn't see any beer cans.
the accusations.
I was 15. I woke up to Heather being on top of me.
Did you have relations with AJ?
No, I did not.
With Mark?
Oh my God. It's Lucas. He's the one who's buying all these people off.
Now,
I believe you have an addiction problem.
This is just not what I came on this show for.
the dramatic conclusion.
If you don't get yourself straightened out, we're going to be burying you. Yesterday, I sat down with Brian and Heather, whose 15-year-old son, Brandon, tragically died 5 years ago of an accidental drug overdose after swallowing and snorting Heather's morphine pills, along with vodka and beer. Now, Heather was tried for manslaughter and negligent homicide in his death, and she was acquitted of those charges last year. I want to be very clear about that. Here's what happened yesterday.
The night that Brandon passed away, I wasn't there. So what I know is Brandon asked Heather to buy him alcohol. She obliged. She bought him beer. She bought him vodka.
Did you or did you not buy these minors alcohol?
No, I did not, Dr. Phil.
I did see them trying to drink.
Are you telling me that you knew your son was drinking that night?
I didn't think he was drinking. I thought
You
I
walked
caught it in
into
time.
the kitchen and he was standing with a drink in his hand, and you didn't think he was drinking?
I know that they were drinking, but I didn't think.
You died because you didn't think. Brandon goes into her room, takes her morphine tablets. He crushes them up. They snort them up their nose, and they continue to drink.
By our math of your reports and the others that were there, your son consumed approximately 22 beers, 4 or 5 shots of vodka, took 3 morphine tablets, and sniffed 4 rails of morphine.
That's the allegations, yes.
Yeah. Do you dispute that?
I do.
Travis decides he wants to go home. Heather comes out in her own testimony and says Brandon was too drunk to drive. He was belligerent. He was falling into the walls. She drives Travis home. Brandon is fading in the back seat as if he wants to sleep, so she comes inside to get him a pillow and a blanket.
I was actually, oh good, he's sleeping. I gave him a pillow and a blanket and gave him a kiss goodnight.
Heather never called 911. What kind of animal is she? She's a monster.
Are you on medication now?
Minimal.
Because you're slurring your words.
I have brain injury, Dr. Phil.
I have a card here of your behavior prior to the show, according to your friend Bernice.
Last night, what you did to me is unforgivable, Heather. She took 39 narcotics within 20 hours. I honestly believe you died. Your eyes rolled in the back of your head. You started seizing, and then your mouth fell open. My son had to witness all this, Heather, my 11-year-old son. I was so scared, Heather. I cannot believe you did this to me.
And now the story continues. Dr. Phil's big ultimatum for accused mother Heather.
Now, one of the consistent allegations against Heather was that she may have supplied her son with the alcohol he drank the night of his death. Now, some of Brandon's friends who were there the night he died are here today to tell their side of the story. Take a look, and then we'll talk.
I really saw a change in Brandon's behavior when he went and lived with his mother. Brandon started partying a lot. Heather knew we were partying. She would buy us the alcohol for the parties.
I witnessed Heather buying alcohol for not only Brandon, but also for me on numerous occasions.
She partied with us a couple times, but she'd usually stay in her room. She would let us party and pretty much do whatever we wanted.
We'd go to the hotel rooms and she'd buy us beer and liquor, weed, hang out there, drink, have fun.
The night that Brandon died, we go to Mom's house, had 2 or 3 beers, started doing some vodka shots. We were hanging out in the kitchen, which is very close to Heather's bedroom. He comes back out with her purse, pulls out an orange pill bottle, and started crushing them on the table. He did one I couldn't do it, so he ended up finishing what he had portioned out for me. Then I did decide I wanted to go home. I went and asked Heather, Brandon's mom, if she could bring me home. So she ends up coming into the kitchen, all the alcohol, the painkillers. Very, very obvious what we were doing. She didn't say like anything, so got dropped off. Last time I heard Brandon's voice was him like singing to the radio in the backseat and like, slowly faded away.
I walked to the kitchen, saw the mess of pills and cans all over the kitchen counter. I was pretty worried what was going on, so I waited for Brandon and Heather to get back. Only Heather walked inside, and I asked, do you think we should bring Brandon to the hospital? And Heather said, no. I checked on Brandon a few times, and I went to sleep. In the morning, I walked into the garage. I found him passed away in a car. Seeing his face is still burning in my head. It's very hard.
I do feel that Heather killed Brandon, knowing that she bought him alcohol, weed, and I knew that he was taking prescription drugs from her. I don't know if she gave it to him or if he took it, but either way, she knew about it.
She could have brought him to the hospital. Instead, she tried saving her own self.
She is the reason why Brandon isn't here today. She had a responsibility to take care of him, and she didn't.
Well, joining us now are Travis, AJ, Mark, and Chris. And guys, thank you so much for being here. I wish we were talking about anything else besides this. And I can't tell you how much I wish Brandon was in the fifth chair sitting right next to you. Chris, let me talk to you first. Now, you say you witnessed Heather buying Brandon and friends alcohol. Is that true?
Yes.
And tell me about that.
That was really hard. I was 15 years old and I just witnessed my friend pass away. And police are asking me if we bought alcohol. Yes, we did. I had a hard time remembering when. It wasn't. We went to Ashford Spirit, and I still remember that night very clearly. Usually when we bought alcohol, it was usually that night. But it was not that night. It wasn't the night before. It was before that. We went in. Heather and Brandon went in because Heather could not physically pick up the beer. She had Brandon go in with her and pick it up.
But you say you don't drink.
No.
So who were you buying it for?
I wasn't in there buying anything. I told you, the videotape at Ashford Spirit,
Which is a store.
which is a store, they didn't know me, and they have camera right there with everybody coming in. They did not see me at all the day before, the day of, or the day after buying. They didn't even know who I was, buying alcohol for any one of those kids.
Did you ever go in there and buy alcohol with Brandon?
No.
Never happened.
No,
Chris?
children weren't allowed in there. That's ludicrous.
Chris, what do you say about that?
He's listening to
All I really
his
have,
buddy
all I
right
really
there
have to
and what to say.
All I really have to say is if you were 15 years old, would you go to your family's package store to buy alcohol? Would that make any sense?
Well,
And did you said you showed Heather the crushed pills that Brandon took from her purse?
Yes.
That night. You showed them to her when?
When she got back from dropping Travis off.
Okay. So when she gets back from dropping you, Travis, off, you show her the crushed pills. She comes in without Brandon.
Yes.
He's in the car. She comes in without him. You show her the crushed pills on the counter and say what?
I showed her what he was doing. I said I was sick. I hadn't been up. I showed her everything on the counter, and I asked her, should we bring Brandon to the hospital? She said, no, he'll be all right. Just we'll check on him for a little while, which in turn meant I was going to check on him because she went to bed.
Did you check on him?
I checked on him twice.
Did she ever check on him?
No.
Okay, why did you leave your son in the car? Why did you think he was asleep in the back of the car? Did you think he was drunk?
No.
You just
No,
thought he was
I thought
asleep?
he was finally, it was like 5 in the morning, and he was finally getting some sleep. So I went in, got a pillow and a blanket, gave him a kiss on the forehead, love you, baby, and that was it.
But when it came time to take Travis home, you didn't want to ride with him driving, correct, Travis?
He's underage.
Why?
He didn't have...
He was very, very drunk.
I'm sorry?
He was very drunk.
He was very drunk?
Yes.
And did you tell Heather that?
Yeah.
You said he's too drunk to drive me home?
Yeah, I did.
I understand he didn't have a license and he was underage, but he did drive.
Yes.
And you said, no, I don't want him taking me home. He's too drunk. Did he tell you that?
No.
Travis did not tell you he's too drunk, come take me home.
No, he said, I want you to take me home. And he also told me that he snuck out and that he didn't want me to tell his father.
We haven't heard everything Brandon's friends have to say about Heather's behavior. One of them has another shocking accusation. We might as well get it all on the table. We'll be right back.
We got a hotel room. Heather bought us a liter of vodka and a six-pack. All three of us were pretty drunk. I woke up to Heather being on top of me.
You got to understand, Heather, you have a serious, serious addiction.
How dare you? This is just not what I came on this show for.
Heather bought Brandon marijuana all the time, and I didn't know it. These struggles that we went through with his drug use, the whole time he was getting it from his mother, is just disgusting. She was his mother. How can you do that? How do you give alcohol, marijuana, and prescription drugs to a 15-year-old person?
I never bought drugs and or alcohol for Brandon Lee Spezialski. Never.
Well, that was Heather, who says her life has not been the same since she found her 15-year-old son Brandon dead in the back seat of her car 5 years ago. He died of what appears to be an accidental overdose after swallowing and snorting Heather's morphine pills along with vodka and beer. Now, Brandon's father and best friends all blame Heather for Brandon's death because they say she bought her son alcohol and allowed him access to drugs. Here's what DCFS said about what happened. Brandon's mother observed her child inebriated and was reported to have knowledge of his drug and alcohol use on that evening. She had multiple opportunities to seek medical treatment but failed to do so. She failed to obtain medical treatment in a reasonable amount of time. According to her reported time frame, the child died between 6:30 and 8:30 a.m. It is reasonable to believe if Brandon was provided medical treatment during the 4-hour time frame that his mother had contact with him, his chances of survival may have been dramatically increased. Instead, she displaced her responsibility on Chris, who was feeling ill. Now, that was their finding.
That was an allegation. Yes, it was.
No, it was a finding.
A finding of...
By that agency.
Yes.
Department of Child and Family Services.
Yes. I mean, it was unsubstantiated. I mean, they couldn't...
It was substantiated.
Well, it was...
What about yours, Brian?
It was...
Your packet of it before.
Hold on. Hang on.
That put him in depression and started him
We're talking
doing
to
drugs.
me. We're talking to me. We're talking to me. These are not unsubstantiated because we have Chris here who's saying he showed you the crushed up pills on the counter.
He's saving himself because he
I'm not
changed
sure
his
how
story.
that helps him.
No, he changed his story because first,
And AJ
I'm sorry to
is
interrupt
saying-
you, but first Brian came to the house, was screaming at Chris. Chris was taking the blame for it. I was out on the porch. I didn't know what was going on. Chris told me before we got in, because there was Doritos, everything all over the place. He told me to go to bed and let Brandon clean up the next morning. That's exactly what you said. Are you going to say that you didn't say that?
When did I say that?
You told me when I started cleaning up to not clean up and let Brandon do it the next morning.
Okay, what were you cleaning up?
Well, I started cleaning there was a table there.
What were you cleaning off of the table?
Well, there was Doritos, just mess, a huge mess. And it was 5:30 in the morning.
Beer cans?
I didn't see any beer cans, no, sir. I told you, I saw the vodka bottle, yes. I don't know where they got that from.
Okay.
But that went down the drain and I threw it in the garbage. And for everybody to boo
Chris,
me, nobody knows my story, so at least...
Well, we're trying to learn it. Chris, were there beer cans?
Yeah, it was the only thing dirty in the house.
I'm sorry?
It was the counter, and it had the pills, the beer cans, and the vodka bottle.
Okay, I think the point is, Heather, that according to what you're saying that you knew your son was drinking vodka, which is worse than beer. Chris is saying he showed you crushed up pills where he had crushed up morphine tablets.
He did not show me that.
Them.
No, he did not show me that. He did not tell me that. Okay. He came in earlier.
Travis is saying he came to you and said he's too drunk.
That was the first time Travis was ever at the house. I never even knew he existed.
Okay, so he certainly had no agenda against you because you didn't even know he existed.
He does because Brian paid him off the $100 a head.
Brandon was mad that I wouldn't let him drive me home. He was too intoxicated. I didn't want any of us to get hurt. And she said, "Oh, don't worry about him.
Can we take polygraphs?
He's been that drunk before." She's known him being that drunk before.
Now, AJ has another revelation about Heather.
In the summer of 2007, I was 15. Me, Brandon, and Heather went to a mall. After shopping for a while, we got a hotel room. We went to the package store where Heather bought us a liter of vodka and a 6-pack of other alcoholic beverage. And we went back to the hotel room. All three of us were pretty drunk. Brandon ended up passing out on the bed where I laid next to him and Heather laid next to me. Earlier in the morning, I woke up to Heather being on top of me, performing in sexual activities. We were having sex. I was very shocked that happened, knowing that Brandon was sleeping 6 inches away from me, and why his mother would do that. So I was very stunned. I felt sick to my stomach, and I had to leave. I didn't know how to tell my best friend about what his mother had done. Since the night in the hotel, I've never discussed the matter with Heather. Been carrying me for almost 6 years now.
Heather, what do you say about that?
I really don't know what to say. All I know is...
Did that happen?
No. The detectives came to my door.
We're not talking about the door. We're asking whether or not you had sex with this...
He was a child.
Exactly.
Exactly. No.
He says he
I was
woke
going out
up...
with... My fiancé was 42 that died in the accident. I don't...
Was this a close call? Is there anything fuzzy about this at all, AJ?
Not at all. Not at all. It happened. It needs to come out, and it happened.
My child died.
Did you have sexual...
I don't really care about anybody else but myself right now.
Did you have sexual relations with him?
A mother will step in front of a bus for a child, not throw him under it.
And later, there's a question on the floor. You're either willing to accept it or you're not.
I'm scared. I am scared. I'm a mess. I have so much anger inside.
He straight up says that you sexually assaulted him in his sleep in 2007.
It really makes me sick.
Did that happen?
No.
It makes me sick to actually have those allegations against me. I don't even know what to do. I feel off. I feel so off. I don't even know what to do with my life. I don't even know. People are coming at me at all angles, and Brian's the main person coming at me.
But you have AJ down here who said, and I quote, because it really jumped out at me.
AJ
He said, and I quote, I don't want any secrets anymore. I just wish I could have my best friend back.
My child died. In my arms, he was gone.
Did you have sexual...
I don't really care about anybody else but myself right now.
Did you have sexual relations with him?
No, I don't.
You cared about yourself instead
Did
of...
you have sexual relations with AJ?
I want to
And
have
then
together
two.
with Brian,
You should have put him first. You're second. A woman always puts her child first.
Of course.
Parents put their kids first. Always.
And you broke his nose and put him in depression and
Hey, listen, a mother will step in front of a bus for a child, not throw him under it. That's what you did.
Did you have sexual relations with AJ?
No, I did not.
Did you have sexual relations with Mark, who's sitting right next to you?
Oh my God, Mark was my son. That's ludicrous. I took care of him since he was a child.
Mark, what do you have to say?
I was 11. It was the exact morning of September 11th. I was home from school. I actually got suspended. I woke up with her hand in my pants, and just straight to the point, I remember she just said, when we stood up after, it was probably 15 minutes after, and she's just like, I wish you were older. Or only if you were older, sorry.
Did that come from him?
Nah, it's more of what I thought about is, Brandon, I didn't want to have to bring all this up.
Mark, you're all about the money.
Yeah, you're right.
You came to me for cleats. I didn't give you any more money. There was no money. You went to him. Everybody else is being paid off by him, and I have proof of in those testimonies that I gave you. There was text messages when he opened a salon and said, it's $100 a head if you testify against me and say that I bought drugs and alcohol for him. That's why he did that. It was him. He's the one who's buying all these people off. I just have no proof of it, but
well, let's ask him. Mark, did he pay you to say that, or did it actually happen?
Dr. Phil, absolutely not.
Right.
No.
And AJ, did this actually happen?
This actually happened.
Do you want to hear some thoughts from me?
Of course I do. I feel like the whole world's against me. That's what I feel like.
I understand.
And everybody, this is my life. I go home to this.
I understand.
And I'm concerned, and I don't know how to get on with my life now.
Take some responsibility.
Well,
Keep
listen.
talking, Brian. Shut your mouth for once.
You've been charged with manslaughter twice.
They were both accidents.
You come out here, you're slurring your words. If you don't admit what's going on and get yourself straightened out, we're going to be burying you in a very short period of time.
If somebody said that I killed my son, I would say that obviously you don't know me. I loved my child more than I think anybody could ever love a child. I still love my baby. I still talk to him all the time.
Bottom line is, he died because of her. If she wasn't in his life, he would have lived.
We've been talking to Brian and Heather, whose 15-year-old son, Brandon, tragically died 5 years ago of an accidental drug overdose after swallowing and snorting Heather's morphine pills, along with vodka and beer. Now, Heather was tried for manslaughter and negligent homicide in his death, and she was acquitted of those charges last year. I want to be very clear about that. Brian says he still believes she's guilty. In fact, he brought a civil suit against her and got an award of damages against her for the death. And, of course, there are very different standards of proof in criminal versus civil proceedings. You know, I wasn't there for any of these events. Are you with me here? You listening to me?
Yes.
I know that he is very upset, has a lot of unfinished business, has taken out ads against you, has sued you, sought your prosecution. Is part of this driven by his own guilt for saying to himself that he should have seen this coming or something? I mean, only he knows that. But what I'm looking at is just the pattern here. And you've been charged with manslaughter twice. I think alcohol and drugs have been involved both times.
Yes, I was connected to 2 deaths.
Yeah.
But they were both accidents.
I understand. And they both involved...
And I loved them both very much.
They both involved alcohol and drugs, though, correct?
Well, yes.
Okay, I'm just saying.
Yes,
I'm just telling you.
yes.
I'm just telling you in
But
terms
I
of...
don't drink. I don't... I'm on prescription drugs. I'm trying so hard to get off of them.
But really listen to me right now. It's
sorry.
important that you hear this.
Go ahead.
Because, you know, I kind of go through a differential diagnostic process in my brain. This is just the way I think. And so I look at long-term patterns, and I see here that you've been been charged with manslaughter twice. Both times have involved alcohol and drugs. The second time, your own son tragically lost his life. We have Chris here who is saying that you certainly knew that there was drinking and drugs involved. We have this young man, Travis, that didn't even want to ride in the car because of fear that your son was so incapacitated that he couldn't operate the vehicle safely. Then we have these 2 young men in the middle, AJ and Mark, who are saying that you've been inappropriate with them on 2 occasions. I have no doubt that involved an altered state of consciousness. We have your friend who you brought with you from Connecticut to come with you and support you here, who says that you're yelling, screaming, embarrassing her, actually took enough medication to shut down your respiration. She's pounding on your chest, slapping your face, rushing you to the emergency room. You come out here, you're slurring your words, you're making no sense with many of the things that you're saying. And so it tells me that you are in a very compromised and incapacitated state. This is not my first time to do this kind of thing. And I believe if you don't admit what's going on and get yourself straightened out, we're going to be burying you in a very short period of time. That's what I think. I believe you have an addiction problem. I think you need help, but you have to take it. And if you don't, you're going to wind up dead. Will you make the commitment to do it?
Brandon was my only child, and anybody that loves a child more than themselves knows that that is such a huge change in anybody's life. That hole in my heart will never heal. Best card I was ever dealt is having my son Brandon. The worst card was when I lost Brandon.
I believe you have an addiction problem. And I think it is impairing your thinking, it is impairing your judgment, and I think you are medicating yourself out of guilt and fear and running from it, and you can run, but you'll just die tired because you can never escape it. And the one thing he said, as much as he has disdain for you, is he said, admit what's happened and get yourself straight. Even he, through all of his angst and hatred towards you, is telling you to get help. And you need to get help. If you do not, you're going to kill yourself and probably somebody else. And the best friend you got in this room is sitting right there in that chair beneath. And the second best friend you've got in the room is me. because I'm telling you, I don't think you're some horrible person that should be put under the jail. I think you need help. And if you'll take it, I'll set it up and give it to you. I will get you the help, but you have to take it. And if you don't, you're going to wind up dead, bottom line. And you can debate what you knew or didn't know that night. I think you were high that night.
Dr. Phil, when
and
your
made
son
really
dies,
bad judgment.
You want to die. I want to die every day of my life.
I agree. I understand.
I mean, you're not supposed to ever cremate and put in a little box that I saw that he did. A child.
I don't know what you want out of this, but I'm telling you that you're not ever going to have a rational conversation with her until she's clean and sober. And that needs to happen before anything else happens. And I'm telling you, I will make arrangements to put you into a dual diagnosis drug rehabilitation facility that will deal with your depression, it will deal with your personality issues, and it will deal with your addiction. If you will take that help, I will set it up and make it happen for you. But the deal is, you go there from here. You don't go home. You don't go get your stuff together. You go there from here, direct. There is no stop in between. And I think you have to have medical supervision concerning withdrawal and detox. And I think without it, you could put yourself in serious harm's way. So I think this has to be medically supervised, and I think it has to be to criteria, not some 28-day wonder. I think you have to work till it's right. And if you have any options, then I don't know what they are. I'm offering this to you, and I'm asking you, will you make the commitment to do it?
My doctor is working with me back home.
Yeah.
Let me finish, please. Let me talk,
okay,
please.
You think about that.
Had their time. Let me talk.
You gather your thoughts. We're going to take a break. Then you can tell me what you want to say. There have been a lot of allegations made today, but Brian says he only wants one thing from her. I don't know if he's going to get what he came for or not, but we're going to talk about that when we return, and we're going to let her say what she wants to say. We'll be right back. What is it you want from her?
I really don't want anything from her. I mean, I came to the show for some awareness for parents.
I understand.
If she gets help, that's great. I wish she would take some responsibility for actions. It would help in her getting better, I think, and moving forward with her life. That would be, for her sake. I don't really care what she does at this point. But, I came here, parents that are having problems with their teens, what signs there are, if there's a number they can call, a hotline, where they can get help. I mean, those are important to me because we found ourselves in a position, where, I didn't know what to do. I didn't know she was providing it, but it was very difficult for me as being a parent to get help and information. So that's why I came to the show.
That is in the absolute DNA of the Dr. Phil show. And we talk about this on a regular basis, and you're right to bring it up. It is a very relevant sort of thing. We have so many resources on drphil.com for it. And let me tell you, parents, if you're the popular mom, the popular dad, where all the kids think you're cool because they can do what they want to at your house, let me tell you, that's a ticket to hell. It's not going to happen.
One thing
I've asked you straight up. This is, I'm making an offer to you. I will arrange for you to go to Origins Recovery Center. It's a dual diagnosis treatment center. They deal with the psychological issues, the medical and biochemical issues, the addiction issues. I'm offering that to you as a gift to try to get your life back in order. If you want that gift, you need to say yes, but the caveat is you go there from here.
Heather,
No, can I
Could
just
you
say
do this for
one more
Casey
thing?
Brandon? I
just
named
want-
my son after her son in memory of her son. That's how much I love Heather. I would do the world for Heather. And the reason I'm here right now is I was going to testify and sit up there, and I do believe Heather's a beautiful, wonderful mother, and she loved her child to death. But you got to understand, Heather, you have a serious, serious addiction.
Okay.
And I watched you almost die last night.
I want you to answer my question. You either are willing to submit yourself to care and treatment or you're not.
Dr. Phil, I am, but I also want you to know that through my whole entire relationship with Brian, he has been abusive. I left him. I divorced him because he was abusive. Then he turned his hand on Brandon.
You should put
I
that.
had a restraining order. He had to go to anger management. I mean, he needs help too.
You should
he
put
just
that.
put on Twitter about his daughter is too fat, and he's showing her how to lose weight.
You should put
He
that
needs
on
help too.
You should put that on your list of things to do at the treatment center.
Yes.
To talk about that and to deal with that.
I don't have anger management problems. He
The
does.
question is very simple. You are either willing to leave this stage and be escorted to Origins Recovery Center on South Padre Island in Texas,
Oh, Heather,
or you're
please.
not. It's yes.
Do it
it's
for
a
Brandon.
yes or no.
How dare you guys? How dare you? This is just not what I came on this show for.
I understand. There's a question on the floor, Heather. You're either willing to accept it or you're not.
I don't even know what to say. I'm so confused right now. I am so confused right now because I came here hating him for what he did to Brandon. Now somehow it's always turned around on me,
not turned
between
around on
the
you.
media and everybody
I'm not
else.
turned around you. I'm offering. You can't be the victim when somebody's offering you a gift.
Thank you. And I thank you so much. And thank you for having me on and listening to my story.
Are you willing
for
to
help.
accept this treatment? You asked for help. This is it.
Yes, I would love to, but there's other people involved that need help too.
All you need to worry about right now is you. You're either
Yes,
willing
Dr.
to
Phil.
leave here and go there, or you're not.
Can if I say yes, can you please look at him and tell him to all of them to leave me alone forever? No threats on my Facebook, nothing. I don't want anything to do with any one of those people that have hurt me.
Well,
None.
there's a real simple thing to do, and that's just unplug from Facebook. You
No,
just
it's
don't
not
need to
that easy.
That's not what you need to worry about right now. I'm offering you the treatment. You're either going to go or you're not.
I need to speak with my parents first.
Well,
Her parents are
They're
enablers. Her
Okay.
parents are enablers.
well, you're a grown woman, and
You've always hated him, Brian. You
You're-
hate yourself.
You're-
You have no soul. You
you're
have
a
no
grown-
heart.
Heather, you're a grown
Dare
woman.
you?
So I assume your answer then is no.
No, I'm not
Because
saying
the offer
no.
expires when I walk out of here. But understand, I do have a
I'm
responsibility.
Scared, Dr. Phil.
I understand.
I don't really think I have. I have gotten off most of everything on my own with my doctor.
Then it'll be easy.
I came here. I had a behavioral health appointment with a therapist, and I said no to them to come to your show.
Good. It's a good choice.
So if this is a better choice for me to go there, then of course I'm going to say yes.
Well, do you think I know what I'm doing?
I want to heal my heart.
Do you think I know what I'm doing?
Yes, I do.
I think this is a life-saving
I
offer
wouldn't be here
for
if
you.
I didn't.
I think it's a life-saving offer for you.
I hope so.
And, understand, since starting this show, I've received 5 million letters of people asking for help, and very few get through. You're here. I'm offering you this help, and you need to take it. And understand there is a condition. And you can't go backstage and change your mind. So I'm just asking you to do this voluntarily.
I was just hoping to die naturally. I never, ever thought of hurting myself.
Well, no, I don't mean that. I mean just, hell, if it hadn't been for Bernice, you'd be dead now. I'd be talking to an empty stool if she hadn't kept you alive last night.
Then that's my destiny.
Yeah.
Your destiny is
I really
to get help,
know that
Heather.
if it's your time, it's your time.
Well, then die at Origins. I'm asking you.
I'm scared. I am scared. I mean,
We'll talk
do you
about it more
know how
backstage.
scared I was to even come here?
Oh, I can imagine.
I
My
have
God.
been in that house being afraid to go anywhere for so long for the sake of being, fingers pointing and everything, and not everybody knowing the whole story.
So, you going to go or not?
Yes. Yes, I will go.
We'll make the arrangements. We'll get you transported there. We're going to sit down with you backstage. We're going to pop up a website, show you where you're going, give you all the information, all of which you're entitled to. But you're going somewhere because
Doctor, I'm a mess. I have so much anger inside. I don't know what. That's why I'm here. And I did place a lot of. Can I please place a lot of anger on other people? Like I blame other people. Yeah. When it was hard on me. I'm the one who found my son, and it was easy just to say it wasn't. I could have done something differently. I mean, even the doctor said, "Oh, he didn't suffer. He died in his sleep. It was an accidental overdose," which helped me. So I'm scared. I am so scared of being without my little dog, which is and my parents and my home, which I have squirreled away in because of what people have done to me, like Brian.
Well, this is your first step back into life, and I accept your commitment. Okay? All right. Well, thank you very much. Try to turn this around. Okay. All right. Even though Heather accepted my offer of treatment on stage, she changed her mind after the show was over.
I want to go home.
So staffers called 911. The police were dispatched and an EMT found reason to take her to the local hospital for evaluation. Heather was evaluated by doctors at the local hospital, held overnight, and released the next day. She decided to fly home and not to a treatment center.
Today on Dr. Phil.
I love Chris, Dr. Phil. Chris loves me.
You both love the same guy.
An obsessed love triangle.
I've been in a lot of these cat fights before. You said she's a fat lesbian whore.
Yes.
And you say she's a psycho.
Most definitely.
Aileen posted a lot of bad comments about Sandy online.
Sandy says, I am thankful for my electric blanket. Aileen responds, with all that fat, you need an electric blanket?
They both claim they're the one he loves.
You say you were engaged to Chris.
He gave me this ring. We looked at wedding dresses.
But what does he say?
Did you ask her to marry you?
Not that I can recall.
Do you have trouble being unclear?
I do sometimes.
Let's do it.
Have a good show, everybody. Here we go.
I hate to see people suffering, and you've heard long enough.
Stand by, Dr. Phil.
I'm going to get you the help that you need.
In 5, 4,
This is going to be a changing day in your life.
Go, Dr. Phil.
Today, 2 women fighting over 1 guy. Sound like a dream come true for most men, right? But this love triangle has turned into a nightmare for him. Talking about our guest, Chris. He is caught between his ex-wife, Sandy, and his ex-girlfriend, Aileen. Now, he's not with either one of them at the moment, but says they are each obsessed with getting him back. Now, both women say they are sure that they are the one that he loves.
Chris and I were married about 3 years when our relationship started falling apart. When Chris and I divorced, our daughter and I moved out of the home.
A few months after Sandy moved out of the house, I got a roommate.
Christopher had put an ad on Craigslist. I answered it. Christopher opened the door and I said, "Oh my God, this guy is so good looking."
After about a month, Aileen and I became romantically involved.
Christopher's ex-wife, Sandy, did not like the fact that Christopher and I were dating.
Aileen and I clashed.
I thought she was a bitch. After 7 years of divorce, Sandy wanted her old husband back. Before I knew it, Christopher was trying to kick me out of the house. I want Christopher back. Christopher is the love of my life.
I want to be with Chris, and I want Chris back into my life.
I think Sandy is a crazy, crazy bitch for breaking up our relationship.
Aileen should butt out and go on with her life.
Christopher and I were engaged. I considered Christopher my fiance. Christopher gave me a diamond ring for Christmas.
I was never engaged to Aileen.
Chris gave her a ring for her 50th birthday because he felt like nobody else would get her anything.
Christopher and I had picked out wedding dresses. Christopher had his wedding tie picked out.
Aileen and I had once talked about what a nice wedding would be, but we'd never actually planned one for ourselves.
I hate to break it to Aileen. Chris does not love her, and he's not in love with her.
She thinks she's in love with Christopher, and she thinks that Christopher's in love with her.
Chris loves me.
Sandy really needs to know she's not going to get away with this, and I'm not going to just disappear out of Christopher's life.
Sandy says Aileen is crazy. Will do anything just to keep Sandy away from her man, Chris. Her man, Chris. It's gotten so bad that Sandy and Chris say they've had to file a total of 9 peace orders against Aileen. Aileen admits to some harassment, but said Sandy deserves it because she's just using Chris for his money.
Chris was able to get a peace order finally against Aileen.
The peace order prevents me from having any contact with Christopher.
It does not protect me or my daughter at all. I am constantly being harassed by Aileen. Aileen contacted the university I was attending to tell them I was a druggie and alcoholic.
I never did that. I told them about the child support that she was not reporting, so she wouldn't get as much financial aid.
At my daughter's birthday party, we heard a knock on the door. It was Child Protective Services. Aileen claimed I beat my daughter.
I felt that Sandy was an unfit mother. I was just looking out for the welfare of their daughter.
Because Aileen has contacted CPS, it has caused problems with me to get a job. Aileen knows where I live. My daughter and I are in fear when it comes to Aileen.
I've driven through Sandy's apartment complex to monitor how much time Christopher spends over there.
My front doormat and my wreath was stolen. I think Aileen stole my wreath.
I live 45 minutes away from her. I'm not going to drive down to steal a wreath.
Aileen is crazy.
Sandy is delusional.
I wouldn't be surprised if she didn't try to kill us. She is that crazy.
Well, charming. I've been in a lot of these cat fights before. You know, this is not my first rodeo, so I'm really interested in seeing who is going to tell me the truth today. I know things neither one of you know I know. I have private investigators, I have staffs, I have talked to people you don't even know that I've talked to and have information from. So you lie to me, I'm going to catch you in a lie. Have you been harassing her?
I have not been around her, bothered her in months.
Now, come on. Is this really how you want to spend your time with me?
I haven't been harassing her.
Have you been harassing her? And you say, oh, listen, I don't have, whoa, what, me? Whoa. Have you been harassing her?
No. I have not.
You have not been harassing her. All right, well, here's a list of harassment that Aileen admits to. She told Chris Neighbors she would kill Sandy. You admit that?
I didn't admit I was going to kill her. She was sitting in my bedroom.
Did you call the university loan office to tell them that Sandy gets child support?
Yes, I
and
did.
therefore she shouldn't be getting a loan? Is
Yes,
that
I did.
harassment?
I did that 3 years ago, yes.
Okay, so, yes. Did you call the adoption agency to get info on Sandy?
No, because I had the paperwork from the house.
Chris's documents, of course.
So you sold his documents. Why did you tell us that you called the adoption agency?
Okay, I called the adoption agency, but
Thank
their phone
you.
number.
So you called the adoption agency. Is this really how you want to spend your time, where I have to ask you things 5 times
No.
before you tell me the truth?
No.
Come on. You've called CPS 2 times to report Sandy.
Yes.
They came to her daughter's birthday party.
I didn't know when they came.
Yeah, well, that's when they came. Did you send a letter to Sandy's boyfriend in 2009
Yes,
and
I
cause
did.
him to break up?
Yes, I did.
You don't consider that harassment?
That is.
Did you cancel Sandy's birthday reservations at a restaurant?
Yes, I did.
So you knew that she had a reservation at a restaurant with Chris?
Yes.
And so you called the restaurant and said, hey, this is Sandy, I need to cancel for tonight. And they show up and they got no reservation.
Yes.
Okay. Did you get her car towed?
Yes, I did.
Okay. Did you ask friends that were working in the collections business to snoop into her credit?
Yes.
Did you nickname her the Queen?
Yes.
Have you called her slut, lesbian, whore, bitch, gold digger, liar, and alcoholic?
Yes.
You took photos of her at the post office.
Yes.
And then a few days ago, you filed a lawsuit against her now.
She threw all my stuff out of Christopher's
You don't
house.
know about this, but she's now sued you in small claims court.
And that's awesome, because you know why? The sheriff's department was there on Victon, and they actually took it out to the curb with us.
Yeah. But you filed a lawsuit, right?
Yes.
Okay. See how much faster things go when you tell the truth.
Okay.
Goes pretty well, right?
Yes, it does.
How about you? You been harassing her?
I contacted her employment to find out and let them know what she does to children, because she works at a daycare location. I sent an email to her aunt to have her to stop and leave us alone. And I sent an email to her father because of her posting a check of ours with the routing account number online because of that filing.
And this is all because you both love the same guy.
I love Chris, Dr. Phil, but like I've told him, am I in love with him? No. Is he in love with me? No. Are we taking it slow? Yes. It's not just about Chris and me anymore. It's about our daughter. And our daughter is our number one concern. Do I want Chris back? Yes.
And you want to be with Chris.
Yes, I've been with him for 6.5 years.
So you sent a letter to where she works.
No, I called.
You called?
I called.
And did they tell you about that?
Yes.
And what kind of work do you do?
I work in a business office in a daycare center. And the human resource told me one day that somebody with a southern accent had called reporting that I had federal and criminal charges and that I was a child molester and that I shouldn't be working around kids and that I should be fired. I've got documentation of that. And
well, actually, I do too. And they didn't say all of that. The letter they sent to you on 7/17 of this year said, yesterday at 3:41, I received an anonymous call at our main office number from a woman with a southern accent, as you say, asking to speak with someone in human resources. She told me that she wanted to warn us that we employed a woman who was dangerous and abusive, and that she, the caller, was concerned for the welfare of the children in our care. She then proceeded to tell me that this person had broken state and federal laws and would soon be served at work. I told her that all of our employees have a thorough criminal background check prior to their first day of work, and we will be notified if there is any problem with the law. I checked the caller ID and found out that the call came from Sandra's phone. I spoke to our employee, Aileen, and told her that threatening and personal phone calls are not permitted at work, and that she needed to make sure that we did not receive any more crank calls of this nature. So they call you here to tell you, don't you have people calling up here trashing you anymore? Okay, sorry, I'll cut back on the trash phone calls. All right, coming up, we're going to find out why Aileen created an alter ego named Claudia in order to keep tabs on her nemesis. And later, we're going to meet Mr. Wonderful. Because Chris is here. We're going to talk to him and find out how he feels about being in this crossfire. We'll be right back.
When I think about Sandy, I feel disgusted.
When I think about Aileen, I feel sorry for her.
I personally don't think she's attractive. Sandy's fat.
She's psycho.
When I think about Sandy, I feel disgusted.
When I think about Aileen, I feel sorry for her.
Sandy's a slut. Sandy has dated a serial rapist. Sandy will sleep with any man that will sleep with her.
What's important for people to know is she's psycho. Nobody wants her around.
I personally don't think she's attractive. Sandy's fat. At one point, she was living with a girl, so she might be a lesbian whore.
What Aileen needs to know is she needs to get help.
What Sandy doesn't realize is your past always catches up with you, and karma will get her.
She's fat? You're no minnow.
I know.
You said she's a fat lesbian whore.
I said that.
And you say she's a psycho.
Yes, most definitely. I mean, she even threw our wedding bench away, and me and Chris aren't even together anymore.
What's a wedding bench?
The bench that we got when we got married, that was sitting outside our home.
Oh.
That's been sitting there for years. I just put it on the curb.
Well, I've been married 37 years now. I don't have a wedding bench.
You didn't put it on your wedding registry.
Oh, okay. You got a list. So you've been with Chris for 6.5 years.
Yes.
And you two were in love.
Yes.
You say you were engaged to Chris.
Early on, in like 2008 or 9.
He gave you a ring.
He gave me this ring last year.
This ring, may I see it?
Yes.
Nice. Very nice. Very nice. Now, that's an engagement ring.
He bought it for me for my 50th birthday. We're not engaged, but I think there's feelings there.
Did he say that was an engagement ring?
No, he did not.
Did he ask you to marry him?
Long time ago when we were engaged, yes.
Oh, you were engaged?
We were.
But he didn't ask you to marry him?
This one here, no, I'm not engaged. He bought me this ring because I wanted it, but he says that we're just friends. But I don't think friends just buy somebody a 1-carat diamond ring.
But when did he ask you to marry him?
In 2008 or 9, and then we split up. We didn't really split up. One day he just said, we're not getting married, but we continue to live together.
But you were engaged. He did ask you to marry. How did he do it?
It was just, it wasn't ever like a proposal. It was just something he wrote my dad and sent him an email one time.
You have copied that email?
He said, no, because Christopher deleted it off of the computer. He had said, you know, I would like to marry her to make her happy. We had looked at wedding dresses. We had picked out his tie. And then just one day, we're driving in the car and he's like, we're not getting married. There was no explanation, nothing. And that's something that's, you know, kind of...
That hurts.
Yeah. There was never like a formal proposal, as you say, you know. But it was just an understanding that we were going to get married.
Yeah. Because usually
Well, usually
there's a question.
There is a.
Because I remember when Robin asked me to marry her. Just kidding. Just kidding.
Told you, honey. I didn't ask. There was never like a proposal either.
But you did wind up married.
Unfortunately,
But that's
yeah.
kind of gone downhill because now he has a protection order against you.
Yeah, he does.
Now she's pulling him away and he starts spending time with her because he wants to be with his daughter.
He tells me that he just wants to spend time with his daughter, which I didn't have a problem with, but every Wednesday he'd go eat dinner at her house and she'd be posting stuff on Facebook.
On your fake account that you're watching.
Chris and I are a family. Chris and I cuddle on the couch. You know, Christopher calls me during the day to send me little notes to say I love you. You know, Chris is my baby, loving my baby. I mean, every day, something different.
That just chapped your ass, right?
Yeah, I mean, every single day because I know him and Chris does not sit there and cuddle on the couch and, you know.
Obviously, it's who he's with that he's cuddling with.
Thank you for second chances. She's calling his.
Well, did you harass
parents.
her on Facebook?
If she made a comment, I would make a comment back.
Oh, wait,
It's nothing inappropriate just to comment back.
Some were inappropriate. She put her inappropriate things
Did
about
you have
me.
Did you have a fake ID?
Christopher and I had made one years ago on Facebook.
So you did go on using a false ID so you could get
Keep track of
friended.
When I sent her a friend, she accepted the request, and then later on,
You say
she took
that's
me
because
off.
she's desperate for any friends she can find.
At one point, she had over 1,000 friends.
Is that bad to have
Accepted.
1,000 friends?
No, but I just don't think that you. I just think that you don't personally know that many people. You get a request. No, it's not. But I'm just saying.
Dr. Phil, can I ask a
Well, I've got millions. Does that mean there's
'cause
something wrong with me?
No, but you're like Dr. Phil. We're just like regular people.
Sandy says, I am thankful for my snooze button and electric blanket. So, Aileen, as Claudia responds, with all that fat, you need an electric blanket?
In order to keep tabs on Sandy and I, Aileen has used several fake profiles on Facebook.
I used a fake name of somebody that she went to high school with.
Aileen posted a lot of bad comments about Sandy online.
Aileen has called me a whore, a bitch, a gold digger.
Sandy would post about how they were a couple and she was in love with Christopher and that he loves her. When I see these posts, I know that they're lies.
Okay, well, actually, that's kind of interesting. But I said I had a lot of information that y'all didn't know I had. I actually was able to go backwards and capture a lot of those exchanges between you as Claudia and you.
They're probably bad. I'm not going to deny it.
Well, here's what Sandy posted. Sandy, I am thankful for my health and everybody that stood beside me through the years when I didn't know if I would see the next day. Well, Aileen, as Claudia says, too bad you didn't drop dead.
She just posted that because she wants sympathy from other people.
I don't need sympathy.
Sandy says, I am thankful for my snooze button and electric blanket. I enjoyed sleeping in a little while longer today. Thankful for the omelet my baby made and served me in my bed. So Aileen, as Claudia responds, with all that fat, you need an electric blanket? Really?
I don't need an electric blanket, and I'm fat too, so.
And you don't have Chris sleeping in your bed any longer either, do you?
Oh, and you do?
Many nights a week.
Well, I hope he gets tested.
Sandy says, dinner is served, and puts a picture of dinner. Ailenius Claudia says, you cooked this last time. Pasta, biscuits, meat, green beans, no variety. No wonder you're so blinking fat. Sandy, having dinner with the in-laws and loving our family. Ailenius Claudia says, bitch, you are divorced. They are not your in-laws. So Sandy Post ordered our dog Caesar his Christmas outfit for pictures so he will match everyone. Love my doggy. Aileen Post, you dumb bitch. Why do you continue to lie? You walked that dog like once. Sandy says, with my wonderful daughter and Chris, we discussed all we're thankful for, and my daughter said she was thankful for parents that love her and having our family back together. That means a lot to us both. Aileen, as Claudia says, so sorry that her family getting back together will be short-lived. Your daughter has had so much turmoil in her life. No wonder she has so many issues.
She has had turmoil in her life.
She's also adopted, and I kept mine. You didn't have yours.
Sandy says the best thing in life is finding someone who knows all your flaws, mistakes, weaknesses, and still thinks you're completely amazing. Aileen, as Claudia says, OMG, this is so funny. You have a bunch of flaws. You're fat. Your blank smells like dead fish. You're a cheater, and your biggest mistake was moving here, but that won't last long, and you're amazing in your own mind. You're blank. Really?
Christopher told me that.
Very classy.
Okay, that wasn't one of my classroom
For a
moments.
50-year-old lady, that means a lot, right?
I'm sure everyone is dying to know what is so great about this guy, Chris. Does he have some magic elixir or powers that have put a spell on these two women? So I'm going to bring him out here, but you can't be here because there's a no contact order by the court. You can't be in contact with him.
Okay.
And so I'm going to have you go off.
Okay.
And we're going to put you in the green room with full monitor. You'll be able to see everything. You'll be able to hear everything. You'll be able to talk, but you're going to need to talk to me.
Okay.
You can't talk to him.
Okay.
So I'm going to move people and furniture and cameras and do everything I can to stay within the spirit of this agreement. We'll be right back.
I want Chris back into my life.
And I don't really consider us a romantic couple.
I am hoping that Christopher and I will work towards getting married someday.
Aileen can't understand that I don't love her anymore.
I want Chris back into my life. Chris will spend the night with us. He will have dinner with us, but we are not having sex. And we will not until the time is right.
And I don't really consider us a romantic couple. If we didn't share a daughter together, I don't think that Sandy and I would have a relationship.
Chris and I are very happy, and we have a family.
I miss Christopher every day. I feel that Christopher, in his own way, he does love me. I mean, there's feelings there. They may be buried. I mean, every couple goes through ups and downs.
Aileen can't understand that I don't love her anymore.
I am hoping that Christopher and I will work towards getting married someday.
I do not want a romantic relationship with Aileen because of the problems. We really can't even be friends.
I think Christopher needs to see that I've changed and that I deserve a second chance.
At this point, I need for Aileen to move on and out of my life. The most important thing to me is to be a good parent and focus on what's in the best interest of my family.
Well, we've been talking about Chris, but he is here. So, Chris, come on out and join us. you doing? Good to meet you. Have a seat right here if you would. Now, in accordance with the protection order that you filed with the court, you were listening before, Aileen is not out here. She is watching this. Why are you in this mess? This is like a tug of war and you're the rope.
It's complicated. The best way to explain it is it's really progressed. And there were signs that, I should have done something differently a while ago.
How did you and Sandy meet? You two met, you were married how long? How many years?
We got married in 2001 and divorced in 2008.
Okay, so you're 7 years. And how did y'all meet?
Online.
And then how did you meet Aileen?
I was looking for a roommate after Sandy left. I had posted some things.
You met her and then she moved in, but it wasn't a romantic thing until later.
It was fairly soon. It wasn't
like 30 days, a week, 20 minutes.
Less. What I'll say is less than 30 days.
Did you ask her to marry you?
I have not, and
you never asked her to marry you.
Not that I can recall.
Did you go pick out her wedding dress with her?
I remember looking. I don't remember the reason. It was not to plan a wedding.
Aileen, you wanted to say something?
We had planned to have the wedding in South Carolina, if he recalls that, because we were supposed to get married June 26th, 2010.
Okay.
And the daisy tie, that was for the wedding.
Yeah. But that was, I believe that she kind of prompted this, and we just discussed, if we do this at some point, what would we like? What are our
Do you have trouble being unclear with people?
I do sometimes.
Because you sound like you're being unclear now.
Yeah.
Because I'm asking you some questions that really aren't essay questions, but
right.
I'm getting a lot of essay answers.
She was looking at these things, and what do you think of this? When if you were to get married, would this be nice? And
you, at this point, Aileen, you want to marry Chris.
That would be my ultimate goal, but I don't see that as happening. I would just like to be in his life.
Did I not tell you that y'all could be friends, but she would not be near my daughter? Did I not?
No, you did not.
I did. You were not in my house. You have no clue.
Do you want your daughter around, Aileen?
No, I don't.
Why not?
Her intention's just to hurt several people, and my daughter may not be the direct target, but she takes a lot of the emotional brunt of everything that happens. Mm-hmm. Because things that hurt us really hurt her.
So this is hurting your daughter?
Yes.
And so you think Aileen is causing pain to your daughter, unquestionably?
Yes.
Uh-huh. How do you feel about that, Aileen? They're both saying that you are causing pain to their child.
Okay, I don't mean to cause pain to their daughter. She has told their daughter over and over what kind of bad person I am. Sandy has gone as far as contacting my ex-husband and get information from his wife about what happened with my divorce. That is none of her business.
I think we should talk about that a little bit. There's more to this story when we come back.
Chris and I are not the only ones that's been harassed by Aileen. After Aileen and her ex-husband divorced, he got back with his childhood sweetheart, Francina. Aileen did not like this at all.
I have nothing to hide, and Sandy's just looking for dirt on me. I was furious with Christopher for wanting me to move out. I was going to make his life a living hell.
Aileen lost her mind and started doing crazy things.
They took all the door handles off, every single door.
Aileen told the neighbor that she was going to kill me.
I would leave all the lights on in the house. I would run the water.
Aileen would send text messages to Chris. I am flooding your house. I hope you don't care.
My house felt like a war zone.
Well, there's just a small list of things Chris and Sandy say Aileen has done to get revenge. Now, Aileen admits to a lot of it, and Sandy says she is sick of being harassed by this woman. But the truth is, Sandy is not the only one who says Aileen has crazy behavior. Aileen's ex-husband's current wife, Francina, says she went through the exact torture Sandy is going through now. Take a look.
Chris and I are not the only ones that's been harassed by Aileen. Aileen has done this before to her ex-husband and his wife. After Aileen and David divorced, he got back with his childhood sweetheart, Francina. Aileen did not like this at all. Aileen started calling in fake Child Protective Services reports on Francina.
Francina became friends with Sandy because Sandy tried to get information about me and my past.
Francina and I have become friends because we feel like we're going through the same thing with Aileen. Aileen has stopped harassing Francina because she now has Chris and I to harass. Francina has told me that Aileen will continue to stalk and bother me until she finds a new target. I am in fear that until she does find a new target, that she will make my life a living hell.
I have nothing to hide, and Sandy's just looking for dirt on me.
Well, Aileen, what's your response to that? I mean, is that true? Did you harass that woman the way you've admitted harassing this one?
The resentment I have towards Francina is if I'd call to try to talk to my daughters, she would be like, they're not home, you know.
Did you ruin their credit by ordering a bunch of stuff in their name?
I didn't ruin their credit.
Did you order a bunch of stuff in their name?
I didn't order a bunch of stuff. I ordered pizzas and magazines.
Pizzas and magazines. Well, it's interesting. I'm looking at the Twitter feed up here and seeing what our viewers at home are saying. Vicki Whitworth says, "Wake up, people. This child deserves better role models. None of you are 13. Helen Lusk, 1957, says, "For someone who is such a smooth talker, he's sure stuttering around." Fifi Flea says, "There's a lot of denial and deception going on here. This man has been playing both women, and he should admit it." They think you're being unclear, apparently. And you said sometimes you are less than clear.
Yeah.
This is a great time for clarity.
Okay.
Are you interested in reconciling with Sandy?
I believe as far as
Good point.
as far as, you know, just being very close and co-parenting together, we already have. We're doing that. Have I decided, you know, yes or no that I definitely want a romantic relationship? I have not. And so if I'm not certain, the answer is going to be no.
But that's something we had both agreed on, that we're happy. Do we love each other? Yes. Are we in love? No. But do we want to be the parents that our child needs? Yes.
I'd like to state my opinion on this. I've been accused of lying and accused of playing them, and I'd like to know how it is that I'm doing this. And I've never suggested to anyone that, you know, I'm a smooth type of character.
Well, that's not an opinion. That's not an opinion. That's a question, but I will answer it right after the break.
I'd like to know. My family and I are living in fear of Aileen. One of my greatest fears is that Aileen won't get over the situation. And I am afraid that she might escalate her behavior and things could even get worse.
When someone is crazy, you never know what they will do next.
Everybody thinks I'm the bad person. All I try to do is try to keep my relationship together. And I think she's just flat out crazy. I hope Dr. Phil thinks she's crazy. And I hope he tells her.
Well, Sandy and Aileen say they both love Chris. They both want him back. But what does he want? Let's start with Aileen. Do you hope for, look for, or entertain the possibility of a reconciliation with Aileen?
No, I don't think that would be, there'd be any reason for
Would
doing
you
that.
like
We're
to
past
go
that
to
point.
couples therapy with Aileen
No.
and work on this and try to see if there's a basis here for a relationship?
No. I think that my children are, in fear of her and have been violated, and she's crossed the line.
Oh, the only reason that his daughter is in fear of me is because of what Sandy has told her.
You said earlier, I hope Dr. Phil tells Sandy that she's crazy. You said, I think she is. I hope he tells her that. What would be your basis? What would you think I would support that diagnosis on?
She met Christopher. She got gastric bypass surgery.
Right.
She got him to adopt her a child because she couldn't have a child.
Right.
She got LASIK.
Okay.
She cheated on him twice. She left once. He took her back. A couple months later, she cheated on him again.
All right, so you made a good list there. How is LASIK crazy? Getting LASIK?
It's not. I'm just saying her behavior over the years. And
Okay, well, but you listed what those behaviors were that you wanted me to base a diagnosis of her being deranged on. And on that list, you had that she got LASIK.
Well, no, not LASIK, but her posts on Facebook about Chris and I are together, Chris and I are a family, my in-laws, they're divorced. I mean, in her mind, if you go back and look at all her Facebook posts, she makes it sound like they're a family, she's not like what she's presenting now. Chris and I are just trying to raise a child together. So
in what way is gastric bypass crazy?
That is not a crazy issue. Just
Okay, so we could take LASIK and gastric bypass
yeah, you
off.
could
of
take
it.
those off.
So basically, what we're down to is you think she is delusional about the status of her relationship with Chris.
Yes, that is very delusional.
And that she uses social media platforms to antagonize you by presenting things as other than they are.
Correct.
Would that be a fair summary?
That would be a fair summary. And she lies a lot.
And she's a liar and a thief and a cheater. You forgot that she dated a serial rapist.
She did. She did do that. Christopher can verify that.
These would seem to be relationship issues, not issues that Aileen should burden herself with.
Correct.
Okay, let's take a break. When we come back, I'm going to try to sort this out and make some sense, and then we're done. Is there any equivocation, ambiguity whatsoever about whether or not you want to re-engage and have a relationship with Aileen?
No, I've decided that's not possible.
You see no wiggle room here whatsoever?
No.
Do you want to continue a relationship with Sandy?
I like the relationship that we have.
Aileen, what do you think about what is being said here?
At this point, I don't even know what to say. I mean, I had thought maybe he was open to something. Marriage wouldn't even be in the picture. I just was looking for if we could be friends.
I think this. I think, Aileen, that you have a problem with boundaries. I think you have trouble letting go once you get invested, and I think you hang on with real desperation sometimes. And I think that you need some help with that. And I am offering to get you some help with this so you have an opportunity to sort out your thoughts and your feelings and your beliefs. And at that point, you may look at this a whole lot differently. Will you allow me to make that gift to you?
Yes.
Because you're certainly not getting anywhere the way you are, right? I mean, people are running away from you, not towards you.
Dr. Phil, may I say something?
No, you may not say anything. I'm having a conversation with this woman about her life. It's totally inappropriate for you to interject. Sorry. Go ahead.
Thank you for that.
It was about that.
That wasn't the gift I was offering. The gift I was offering.
No, but I'm just saying, I mean, it's somebody that finally has told her to be quiet while they're trying to talk.
Yeah.
Because that's never happened.
Okay, well, now it's happened. Thanks for being here today. You can go to drphil.com for more information. Chris, thank you so much.